Hi there, Healed listeners. Thank you for joining us for the Healed podcast. I am here with Leslie King today. Leslie, welcome to our podcast. We're glad to have you.
Glad to be here. This is going to be nice and fun, I'm sure.
Leslie is with Knoxville Thermography, and I just recently went and had a thermogram, and we thought it would be beneficial to share with our listeners what exactly thermography is and all the details about it, because it's really beneficial tool and it's completely safe. And so we're going to discuss that topic today. So Leslie, do you want to tell us a little bit about yourself, about how you got interested in thermography?
I'm sure. So, previously, before I opened up this business 3 years ago, I worked as a prosthetist, orthotist, so making prosthetic legs and custom body bracing. Loved the job, but was very burned out. And so, I was looking for something new, and my sister directed me to thermography because she had previously used it for a wrong diagnosis of cancer when she actually just had dead tissue in her breast. And so that's kind of how I started learning about thermography. It was an experience that my sister had had.
Okay, that's very interesting to me. Okay, so let's just we'll cover the basics first and then we'll cover some misconceptions. So I'm just super glad to have you here and get started. So first of all, I'm going to share my screen so that our friends can see what thermography is. So
Yes,
you can see on the screen, if you're watching this on YouTube, you can see on the screen that there's, a body on there, and there's different colors from blue, green, yellow, orange, and red. So, Leslie, will you just start out and tell us what thermography is?
so thermography has been used though in every other country around this world for countless years. It's something that's been used for so many different things. And but it's kind of new into Knoxville.
Mm-hmm.
So for thermography, what we do with that is we're actually mapping the heat in your body, and we are looking for indicators inside the body. So we're not looking for a structure like a cyst. We're just looking for differences in the body. So asymmetries, like looking down your arm, should look the same. If not, then the doctors that do the readings, they know there's something they need to look into. We're looking for increased vascularization, which would be feeding cancer. And we're looking for another thing would be increased inflammation. And so it's a very simple technique.
Okay, so it looks like you're okay. I'm just going to rephrase to see if I understood what you were saying. So, the some red spots showing up on the thermogram would be like hot spots where there might be inflammation. Is that correct?
Not necessarily,
Not necessarily. Okay.
because it's not necessarily about what the colors are, it's about the differences that's in the body. So, an
Okay.
easy way to talk about that would be like, say, you're in a color book and you color your arms, but on one arm there's a black dot or a pink dot that's not there on the other arm, just looks different.
Uh-huh.
That's what they're looking for, these differences in the bodies. Because looking down your spine on the back, looking down your legs, looking down your arms should look the same. If they don't, then that's an indicator that it could be something in there.
That
Does that
is
make
so
sense?
Yes, that makes total sense. So I had thought I had a total misconception just at the to begin with, that it was about the color, but it sounds like it, when you simplify it down to what it's about, it's the symmetry. Is that correct?
A lot of it is the asymmetries.
Okay.
But what we have to remember is when you're in a session for a thermogram,
Mm-hmm.
um, that they're going to have all of the colors in your scan because we're mapping the warmest to the coolest areas in your body. So we're going to see all the color.
Okay.
And so the color isn't exactly what we're looking for. We're looking for something too cold or too hot in the body, and it's different. So those are the
Okay.
types of things they're looking for.
Okay. So when I came in there, I thought my thermogram is going to be just totally like red because I'm middle aged and I'm a little warmer than I typically am. But okay. So let's talk about how you do the thermogram. Do you want to tell us
Um,
a little bit about that?
sure. So, um, I work inside of the health factory, and I have a temperature controlled room between 68 to 72 degrees. And I have a very, very sensitive heat seeking camera that can detect 16 degrees, but every half of a degree is noted. And so put you in the room, give you time to kind of acclimate to the temperature in the room. And then we start doing the different segments of the body. So if you're doing a full body, we start with like head and neck. And we actually just, it's some movement because we ask you to like stand forward or look forward into the camera and then turn to the left, to the right, and to the back. And that's how we kind of get the whole head and neck started for the top of your head to the top of the shoulders. And then we just kind of keep that same pattern throughout the whole body.
Yeah.
Some
So
of the scans are more than just the 4 images. Some of them are 6. But that's how we kind of map the heat, as having you move and turn around so we can see the sides of the body.
So you really, it's as simple as getting your picture taken. So when I went in to get my thermogram, I went in just like Leslie said. I got like a hospital gown to put on, and then I sat there for a little bit to acclimate to the temperature, and then we literally just took pictures. Turn to the left, turn to the right, face forward, face the back. So it's such a simple process. It does not take long. Um, just super easy, non-invasive. There's no there. I don't think there's any danger to having a thermogram, is there?
No, it's non-invasive. There's no radiation, there's no contact, and there's no pain. It's simply mapping the heat in your body. So
Hmm.
there's absolutely no risk at that at all.
So let's talk about a couple of misconceptions that people have. So um, the first one I want to discuss is the thermogram just for your breast area?
Absolutely not. Thermography can see just about anything you would ever imagine that could happen in the body. Um, we cannot see inside the skull, so we can't see inside the brain. But other than that, we can see just about anything imaginable, from any type of diagnosis to a tendonitis to autoimmune thyroid issues. Um, we can see all kinds of things in there. And it's for males as well it is for females.
Okay. And when I went ahead because I'd had some issues with blood flow in my leg and some issues with some blood clotting. And so I went ahead and did the full body scan because I felt like that was what I needed. You can come in though and just do the breast area, but tell me a little bit, Leslie, about how that is that wouldn't replace a mammogram, or it's not the same thing. Talk about the mammogram compared to the thermogram.
Okay, so um, there's a lot of differences in just in the fact that there's no contact and no radiation and nothing invasive for it. And we're always looking for those indicators that a typical scan that you might use would only see what's happening in your body once it becomes like a cyst or some type of a structure that's already created in the body. So we can see these as indicators very early. One of the ones we'll talk about, since breast cancer is so prevalent in our country, um, for example, um, at 2 cancer cells for breast cancer, it typically doubles in about 90 days on an average. But after 2 cells are there, if we catch it early enough, Thermography can see it as increased vascularization, which would be feeding into cancer. And it's about 8 years later that a mammogram would be able to see it as a 1 centimeter cyst.
Oh, wow. So a thermogram actually catches it really early.
It really can for just about anything. And the goal is never to get rid of a doctor. The goal is that we can help provide what's happening in the body before it becomes a diagnosis.
Mm-hmm.
Once it comes a diagnosis, it's a little bit harder to get rid of. But
Mm-hmm.
if you can catch it earlier, you can do some cleansing and change up what you're eating, and definitely share your information with your health provider,
Mm-hmm.
whether it's a doctor, a nurse practitioner, your chiropractor, whoever you rely on for your health provider. You definitely want to share that.
So when I went for my yearly checkup to the gynecologist just this year, she told me, it's time for you to go get a mammogram. And I actually told her, like, I would prefer to go get a thermogram instead of that. But of course, if I needed a mammogram, I would, um, but she said that was fine for me to go get the thermogram and to send her the results, and she would look at those and everything. So, this is not something like unusual. Your doctor should be familiar with thermogram and be able to um, advise you, once they look at it. It's just another piece of the puzzle. Is that right, Leslie?
Sure is, because if you know that you have something in the body now that you want to take action,
Mm-hmm.
you don't want to just like let it keep going and let it keep growing. You want to like get in touch with your health provider.
Mm-hmm. Yeah. Okay. That makes sense. So, um, another thing that I wanted to talk about, sorry, I was trying to look at my screen here. Sorry about that. Another thing that I wanted to talk about, another misconception is, um, on a mammogram, if you have a normal mammogram, does that mean that there's not any cancer there?
I mean, it could be, as there could be something again growing in there that they're just not seeing yet. So
Yeah,
again, it's just early intervention of seeing something more quickly and washing it and de-cleansing in your body, and trying to just get rid of it before again it comes a diagnosis. So yeah.
yeah. So just because you have a normal mammogram doesn't mean that nothing's in there growing and starting to take place already. And a
Yes.
thermogram would help you catch that a little bit earlier.
Yes, that's the big benefit, is seeing things so much earlier.
Uh-huh. And so people would get a thermogram. How often would people get a thermogram?
I would say annually, like going to your doctor.
Mhm.
Um, that's typically the rhythm of it as far as how often you should do it. And then also, I have a handful of people that have different types of disease or cancers, and they're worried about it all the time. And they're wondering, like, if things are getting better in their body or getting worse over time. And so, I have a handful of people that do it every 6 months,
Okay.
just because they want more information, because they do have risk or they already have a diagnosis that they're trying to clear out.
Mm.
So, we can use it for that type of a way as well.
And I was surprised. I'm thinking that you told me when I came for my thermogram that you have a lot of people who have had cancer in the past and gone into remission. Is that correct?
As far as what we've seen
Like
so
you,
far,
they are getting the thermogram while they're in remission to keep a check on
oh,
things.
yes, yes. So, like, if you already have liver cancer and you're taking all of these treatments,
Hmm.
they're also worried about, well, is where else says it could be in my body? It might be gone
Mm.
into other areas of my body now. And because I'm taking all of the treatment, I would like to know, is it actually changing anything? Is it
Hmm.
the same, or is it worse, or is it better? And so this would just be a different way of seeing it.
So the other thing I just want to point out is even though my doctor knew that I was coming to get the thermogram, I did not need, she didn't have to refer me. And I just want to say that um, on the relative, if relative side of how expensive or affordable things are, I feel like this is a very affordable tool for what it shows you, and you only are going to do it like once a year. So I know, Leslie, right now, like your company does not take insurance, but some insurances will reimburse you for it. You just have to look into that and see if you um, are, if that's an option in your insurance. But even if it's not, it's still very affordable. I just want to point that out. So I might come once a year to get the with like a full body scan. And tell me, Leslie, um, tell me where you're located.
Okay, so I am located on Alcoa Highway inside of the Health Factory.
Uh-huh.
It's a big gray structure, closer to the side of like UT Hospital.
Yes, it wasn't hard to get to at all. They've done some work out there on Alcoa Highway, and it was really easy to get to. Um,
Um, I'd like to talk a little bit real quick about the insurance because I
Absolutely.
have found just recently, as in the last day,
Mhm.
that there is a medical code for thermography.
Oh,
And
okay.
so I would say for everyone to call your insurance company, ask them if thermography is covered, and even if they say no, submit it anyway to your insurance because I've already had people coming back in and saying, well, my insurance said they didn't take it, but I sent it anyway, and it come back that they helped pay for it. Some of them are covering 100%, some of them are 40 or 50%, but any percent is a big win for early intervention.
Yes, absolutely. Um, so you can find out, we can find out more. We can contact you. It's just called Knoxville Thermography, and I will post a link to that below the podcast. And is there anything else, Leslie, that you feel like we need to know about, um, just to give us kind of some general knowledge about thermography?
Well, I think about the best thing ever about thermography is that it is very simple,
Mhm,
it's easy access, and it's for everyone. It's
mhm,
not just for women, for guys and gals to learn about what's in their body and make sure they have good self-care. And it's so beneficial in so many ways. And I just absolutely love it.
There's tons and tons of research on thermography. This is not something that's like super new or something that's doesn't is not research based. There's a lot of research on thermography and its benefits. And I can just say for me personally, I know every time I could would be getting a mammogram, that's radiation that's going into my body. And so um, I'm choosing not to do that regularly for myself. I definitely believe that everybody has to make their own health choices and do their due diligence and do their own research. But for me, I would rather come get a thermogram, and then if my if at my yearly checkup my gynecologist says I think you need to go get a mammogram instead, of course I would do that and follow her recommendation. But she was very happy that I was coming to get this test. So, um, if people want to contact you, Leslie, can we just give your phone number out real quick, your work phone?
Sure can. It's 865-310-4808.
And I will put a link to Leslie's website. And I just want to thank you, Leslie, for coming and sharing with us today because it's important. We have so many toxins flooding our body today in our food and our water and in everywhere, everything. So I think it's just so important that we know all the tools that are available to us. So I really appreciate you sharing with us all your knowledge about, well, not all your knowledge on you know, the basic knowledge, what we need to know, and can understand about thermography. And I just appreciate you being here.
Well, I appreciate the fact that you are so interested and you want to share it with other people. And I mean, I'm just thrilled that you are wanting to do this, and I really do appreciate your support.
Well, thank you very much. Hill listeners, thank you for listening today, and be sure to check out the attached links. And if you have more questions, feel free to contact me, to contact Leslie, and we will, I can point you in the direction of Leslie, and we can hopefully answer questions and get you any questions that you might have answered. So, all right, Leslie, thank you. Hill listeners, thank you. And we will see you next time.
Thank you so much.